America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can follow us on our website, americashealthcareadvocate.com. You can also do that on Twitter, on Facebook, and we are on 15 podcast platforms across the country. Every one of these shows is posted on the podcast platforms and our own YouTube platform, America's Healthcare Advocate, with over 450,000 views, thanks to all of you out there in the listening audience. And we're on 238 radio stations around the country, which we greatly appreciate, and all of our radio partners across the country. And today I want a little shout out to the Cape, K-A-P-E, 1550 AM and 95.1 FM, Cape Girardeau, Missouri. Here's a little piece of information you might not know about that station. That's the station that Rush Limbaugh actually started his show on. So the late Rush Limbaugh actually started out on the Cape in Cape Girardeau, Missouri. So we really do appreciate being on the air down there, 1550 AM and 95.1 FM. We want to thank them for becoming part of the America's Healthcare Advocate family. If you are looking for Medicare insurance, if you're chronologically challenged, like me, okay, you may want to call the lovely Carol Lee Steele at RPS Benefits by Design, 877-385-2224. That's 877-385-2224. And if you are looking for employer-sponsored healthcare group health insurance, Maria Allers is an expert. You know, she just took care of a whole chain of McDonald's across Texas and put a wonderful plan in place for their employees. And remember, this is kind of interesting, you know, people that work at McDonald's, they don't, unless they're in California, they're not making $20 an hour, right? So how do you put a health insurance plan together that works? Well, she did it, and she can help just about anybody. So again, anywhere in the country, for either one of these ladies, they're happy to help you at RPS Benefits by Design, 877-385-2224. All right, in studio with me today, this is a rare treat. I normally get a doctor to come in and do a show about a topic. I have two doctors today. So welcome, doctors. Great to have you in studio with us today.
Thank you very much, Gary.
Thank you.
Dr. Emilio John is here with me, and Dr. Arden Andersen. Both of them are here in studio today. And you know what we're going to do? This is an interesting show, and I've been wanting to get this show done for some time. And Steve Sanborn put this together for me and got the docs in here today. And what we're going to be talking about today is a treatment center called PainLab. Now, they're over in Lenexa, but what the focus of this show is, how do you treat medical conditions without prescription medications or invasive surgical procedures? That's what we're going to talk about. You know, there's a lot of noise around this today. You listen to radio, there's all kinds of advertisements, talking about we can do this or we can do that or we can do something else. Well, we're going to give you some pretty good ideas today on a whole series of things that can be done at this practice PainLab over in Lenexa. And I think you're going to find it very interesting. But a little bit about the doctors first. Dr. Emilio John is a chiropractor in Lenexa, Kansas. He's been in practice since 1990. He has a degree from KU Services Administration and a Bachelor of Science, Biological Sciences from Quincy University, Illinois. Prior to starting his practice, Dr. John played professional soccer across the United States in Kansas City with the Kansas City Comets. So you may remember that was our old soccer team. And Doctor, you were a well-recognized All-American soccer player when you were in college. You wanted to play in the pros.
Yes, I did.
And you're still able to walk and talk today. So
thanks to Neuro20.
Yeah, and we'll talk about that. That's what we're going to talk about. So that'll be a great topic. Dr. Arden Andersen is a PhD. He is a DO and MSPH. He is a family occupational medical physician. He is a board-certified prolotherapy and works both an integrative family doctor and soil and crop consultant. Dr. Andersen is a holistic physician that possesses a unique understanding of the link between soil, human health, and climatic issues, public health issues, and real preventative medicine, which we're really going to focus on a lot of that today. He is an author. He's written multiple books: Food Plague, Real Medicine, Real Health, Science of Agriculture, The Anatomy of Life and Energy in Agriculture. So well-versed in what he does. We're very fortunate to have him. Welcome to the show, Doctor.
Thank you very much, Carrie.
So as I said, this is a unique opportunity for us to just kind of go into and explore, and we're going to go through the multiple different topics today as we talk about this type of medicine. But Dr. Andersen, let's just start off with a little bit about the overall thought process behind what brings PainLab together, the doctors that practice there, because there are multiple doctors there, and the various therapies that are being offered. Doctor?
Absolutely. Well, PainLab really is a conglomeration of addressing, primarily we're looking at neurological illnesses, issues, injuries. And my focus initially, why I got involved, was because of my own concussions. I've had 6 concussions and 2 loss of consciousness, as well as my own back problems. I had back surgery in 2020. And a lot of that stemmed back from playing high school football, as well as some military activities. And so it was one of those things that I'd been through all the standard care of addressing concussions, addressing injuries. And as I said, I ended up with spinal surgery. But what I saw as well in a lot of my patients is that we can drug them for pain and the opioid issue. Many people know about the opioid crisis. You could go to surgery, and surgery is usually only a temporary fix, and I can tell you that from personal experience. And as well, then there really are very few other things that actually address Parkinson's, MS, stroke, brain tumors, those kinds of problems that create then disability in patients as far as their life activities, maybe just simple walking. And so 3 years ago, I called because of the ad that Steve had in regarding concussion evaluation in young people. And I was interested myself, and that's where WAVi came in, which is an EEG system that was put together to specifically look at the P300 wave, which is just one wave in there that they look at, but it's a very indicative frequency in the brain to look at overall functionality of the brain-body interaction. And so we can tell just from that reading whether or not a person has had a concussion, whether or not they've recovered from their concussion, as well as perhaps any other problem that may be associated with that brain-body interaction. Well, then, okay, that's nice. You can identify that. But now what are you going to do about it as far as getting it evaluated? And unfortunately, standard medicine is either looking at implanting electrodes in the brain surgery of some other type, or some other kind of drug, which has all kinds of side effects and may or may not work, but eventually doesn't work. And so how do we actually regenerate the system? And so Neuro20 came on the scene, and that system is about stimulating what's called brain-derived neurotrophic factor, which is a protein in the brain.
One more time. This is a radio show. I want everybody to hear this.
Brain-derived neurotrophic factor.
And that means I don't have to pronounce that. That's why I asked him to do it.
But that is a substance in the brain that actually stimulates regeneration of brain cells and nerve cells. And it wasn't that long ago, 20 years ago for sure, we didn't even believe it could be done to regenerate nerve cells. 10 years ago, we didn't believe it was possible to regenerate brain cells. Periphery, yep. Brain cells, no. Now we know we can regenerate brain cells. And so it's fantastic. We can actually regenerate damage in the brain with a bodysuit. And it's really kind of in reverse to what you would logically normally think, because most of the time, if you got a brain issue, you would think, oh, I've got to do something in the brain. But what we have found is Neuro20, through appropriate stimulation of the body, we actually cause a neuroregenerative process in reverse back up through the central nervous system and back into the brain. Completely non-invasive. It's an amazing concept. And it works. And
so we're going to go to break here, but let's just leave it at that. Okay, it's an amazing concept and it works. We come back. I'm going to ask Dr. John, who actually uses the suit to talk about. Remember, he was a pro soccer player, played in college. Okay, you can imagine he sustained injuries. He had other issues. I'm going to ask him to talk about his experience with Neuro20, and then we'll carry on with some other topics. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Don't go anywhere. The doctors are in the house.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, coast to coast across the USA. My producer behind the microphones, Mr. Darren Wilhite, the man recording all of these shows, who edits them and posts them all up on the YouTube channels and on the podcast platform, Mr. Dave Thiessen. And we appreciate everything they do to keep this show on the air. In studio with me, Dr. Emilio John and Dr. Arden Andersen. They are here talking about PainLab. If you want to learn, maybe that first segment intrigued you as you listened to Dr. Andersen, the website is painlabkc.com. painlabkc.com. If you want to call them, they're over in Lenexa. You can call them at 816-337-8558, 816-337-8558. They do have an open house every the first Thursday of every month from 3 to 6 in the afternoons. If you just want to go, and maybe you want to go see what they do over there. What is this all about? Okay, that doesn't cost you anything if you're interested in that, and maybe you have an issue that we're going to talk about some of these issues. That might be a great way to explore it. So Dr. John, let's go to your experience. You were a professional soccer player. I'm guessing you came away from that with a few bumps and bruises and injuries.
Yes,
and when I met you over at PainLab, and by the way, folks, I've been there, been through the facility that Steve runs with the doctors, and it's really quite remarkable. I met Dr. John, and the first thing he told me was how great the Neuro20 suit was. And you heard Dr. Andersen speaking about that in the last segment. So, Doctor, a little bit about your history and, the injuries you sustained and how the Neuro20 has affected you. Doctor?
Well, I've had several injuries from hip to right knees, medial collateral and ACL, and I've had concussion as well. But probably what set me back was a condition called ATTR amyloidosis, which I was diagnosed with a few years ago, about 2 years ago. And I've been getting treated for that, but I've been lethargic for about 4 to 6 years, where I couldn't figure out what was going on until they discovered that I had a genetic disorder that, like I said, it's being controlled, but my lethargy was the worst. And when Steve came to our practice and he introduced the Neuro20, or just really when they were talking about it, the front desk girls were going, "Hey, Dr. John will be the first one to try it." And so they diagnosed all my condition themselves. And I can tell you, since I started the very first treatment, my life changed. I was able to walk. My gait was different. I was walking faster. Now, I'm still not where I need to be, but tremendously improved. Now, the other thing was an overall feeling of wellness. That is, I felt that for several weeks. I've been doing the Neuro20 since, I believe, May. And those are two major things that have happened. And with the overall feeling of wellness, you get to understand the type of pain that you had been absorbing, that you just went along with. Even with pain medication, it was not being taken care of. Other little things that people may not think about, like sweating. For a few years, maybe 4 to 6 again, I wasn't sweating. After I started using Neuro20, when I worked out 2-3 times a week, I started noticing I'm sweating, which was unusual. Well, when I say unusual, it was already part of my life the past few years. So the changes, I didn't change anything but the Neuro20. And those are just a little bit.
So you mentioned the pain that you experienced and that you were taking meds. Talk about. So I'm guessing now you're not taking the pain meds, okay? No, or if you are, you're taking them at a much reduced level. So talk a little bit about that and what the impact of the Neuro20 suit. And then I want to ask Dr. Andersen to describe the suit a little bit. But talk a little bit about that, if you would, Doctor.
I really wasn't taking pain meds a lot. I was doing other therapies. Say, for example, electrical stimulation, which you put 4 pads in an area, which we use as chiropractors.
Right.
In comparison to the Neuro20, a humongous difference, because it covers the whole body.
Right.
The other thing that I have seen in terms of my complexion is better. My conjunctiva is clearer. Conjunctiva.
Right.
No, yeah, because I've been like that for over 3 decades, and it just cleared. The other thing I used to go, I'm talking about how it's impacted my life.
Right.
In terms of, I used to go to get pedicure because I couldn't get down there. I've been doing my own pedicure for the past 2 months. So it may seem like a little thing, but that's huge.
It is huge.
Those are little side effects of the benefits of Neuro20. Flexibility, I'm more flexible. I'm more agile. And also, in terms of, my training now, I'm training harder. I can go longer. I'm more intense. I stopped coaching 4 years ago. I started helping out last week for the first time.
Wonderful.
And so these are things that I wouldn't even dare think about doing.
The difference between doing the electromuscular stimulation with the Neuro20 and, a set of paddles or something. The Neuro20 is basically looks like a diver's wetsuit. That's the best way that I can describe it.
Yes, it does. Suit actually does look like a wetsuit, only it has silver pads in and it has some silver threading on the inside of it as well. You put it on after it's been wetted onto bare skin. And then through the iPad, you have whoever's running it. Steve is typically running it for us. You set the level of intensity of stimulation in various muscles of the body. So basically, it hits 20 different muscle groups in the body. It can be all at once, or we can actually have it set so you only have certain areas like lower extremity, upper extremity, or we can have it set so it actually mimics walking, mimics bike riding, mimics throwing, mimics any activity that you may want to do.
Real quickly, because we got about another minute left here, just about. When you said throwing, that caught my attention. So you've got a young man, let's say he's in high school or college, he's a pitcher or he's an outfielder throwing a ball. Are you telling me that the Neuro20 can help him if he winds up with some kind of an issue and he cannot throw or he's suffering, whatever the case may be, that the Neuro20 can come in and help resolve that issue?
Absolutely. And Dr. Palermo, who is the medical director for Neuro20 overall, talked about that last week when we saw him. And absolutely, that can be done and is being done. You take any athlete. You're not going to take an athlete who's an amateur and make them a pro, but you take a pro athlete. You can increase their efficiency. You can increase their strength, their accuracy, by putting that suit on in that throwing motion.
That's pretty strong testimonial, folks. You've had 2 doctors now talk about this in this segment. I think you'll find that there's some tremendous benefit here. We'll come back to all of this in the next segment, so stay tuned. And if you want information, go to the website, PainLabKC.com, PainLabKC.com. The phone number, 816-337-8558. They do have an open house, first Thursday of every month, 3 to 6. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website americashealthcareadvocate.com, americashealthcareadvocate.com. All the shows are posted on the 15 podcast platforms and YouTube. Compliments of Mr. David Thiessen, our producer on that end, and obviously on the Odyssey side, Darren Wilhite. So it's up there. Now, here's the thing. Okay, so you're listening to this. Maybe this is your child that, plays soccer. Okay, or maybe it's your grandfather that is suffering from, he broke his hip and now he's mended, but he's having trouble walking. He's having real problems. What do we do about it? Well, they want to do surgery. They want to give them medications, whatever the case may be. Maybe it's your spouse. Okay, whatever the case may be. When you hear this kind of a show, they're posted for a reason. You don't have to try to explain this to somebody. Go up to the website or go to one of the podcast platforms. We're on everything out there, from Spotify to Rumble to Odyssey to iHeartRadio, you name it, we're probably on it, okay? SoundCloud, etc. Same thing, YouTube channel, America's Healthcare Advocate is the YouTube channel. All the shows are posted up there in their entirety. They can listen to the show. We cut it down to about 38 minutes. It's there, and they'll understand what you're trying to discuss and why this could make a difference in their lives. You heard Dr. John say this made a tremendous difference in his life, okay? And these are things he'd suffered with for years. So it's worth taking a look at. The website is PainLabKC.com, PainLabKC.com. The phone number, 833-724-6522, 833-724-6522. All right, I'm going to start off with something a little dramatic here. I saw this article in the Wall Street Journal about a week or so ago. 16-year-old boy dead on a football field in Alabama. Doctor?
Absolutely. Brain trauma. And that's a problem that we see. There's thousands of young people that die every year because of brain trauma.
So this was not a heart attack. You hear about these sudden heart attacks, these massive heart attacks that these football players had. This was brain trauma. Doctor?
Absolutely. This was brain trauma. And it's not just football. There's all sports, any kind of contact sports, as well as motor vehicle accidents, bicycle accidents, motorcycle accidents, all climbing accidents, all those kinds of things can give us head injuries. And you never know which person is susceptible to a fatal consequence to those head injuries. It's not the severity of the head injury that really is the indicative issue. It's what is that person's biochemistry? What is the time in their life? How was the torque into the brain from that injury? All of those things come into play. And you really can't predict that, okay, this certain hit is going to be fatal. We don't know that.
Everybody's different.
Everyone is different. Absolutely. And the problem is that we know right now in concussions for young players, about 35% of them, per the research with the WAVi, go back to play before they really should. They pass all the standard testing, but when we do a WAVi on them, we find out the brain is not really ready to return to play.
So let's take a moment here to talk about the standard testing. Basically, what they do is they're given a form to fill out, and they answer the questions yes or no. Am I correct?
Correct.
Okay, and let me tell you a little story. A lot of these kids are coached by their coaches, and they're also coached by their parents, and then there's peer pressure to get your rear end back in there and get on the field, whether it's soccer or whether it's football. And by the way, one of the worst areas of concussion protocol, girls soccer. Am I right, Doctor?
Absolutely.
Okay.
Headbutting is a big issue. Absolutely, with the ball. So it's a problem that is now pretty much universal in our society, not just the United States, around the world, because contact sports are a major component of our societies. Now, obviously, soccer is the biggest one worldwide, but nonetheless, it's still contact sports throughout the world. Absolutely.
That floored me when they were doing these studies. The cheerleading is an issue.
Absolutely. A lot of concussions in all levels of cheerleading. These kids falling, hitting their heads, falling on the ground, all kinds of problems with that. Absolutely correct. So we have to understand that they are also recoverable. And a lot of these kids with the standard approach is, oh, we just wait and see. That's not acceptable. We have to be assertive in regenerating these brain problems. And the movie Concussion is an excellent example of the NFL trying to cover up over time the serious consequences of head trauma. And research over time has found it's not the severity of the concussion, it's any kind of head injury in the most susceptible person that causes a problem. So what we find with Neuro20, with the WAVi, with this whole process that we put together, we can regenerate those processes. As a retired military flight surgeon, the military has a tremendous problem with TBI, and it's not being addressed adequately. So I want to give you a couple examples of patients that we have that are just phenomenal. And first of all, I also want to say what also makes us a little bit unique is that they first see me. This is a medical device. You have to have a prescription from a physician to use Neuro20. They have to change their diet, and they're going to go on supplementation to help regenerate the brain. Now, when we give them stimulation, that brain responds. And so we have a woman who's in her 60s. 20 years ago, she had a brain tumor. That brain tumor was removed from her right side of her head brain. She had chemotherapy and radiation. She was left looking like a right-sided stroke patient. In other words, her left arm was curled up. Her left hand was completely contracted and curled up. Her left leg and her left toes, her left foot was contracted, and her toes contracted underneath her as well. And she could hardly walk. I've been working with her for a number of years, bioidentical hormones, getting her diet around, getting her nutrition around. She's done every kind of physical therapy and occupational therapy, speech therapy that you can imagine that stroke patients go through. And I called her a couple months ago and I said, I think we have a new treatment for you. I want you to come on in. So long story short, after the second treatment, this woman opened her left hand on her own. Her husband started crying. This was the first time in 20 years this woman was able to, on her own, without forcefully grabbing a hold of her fingers, to open her hand on her own. And when she got home, she was able to pick up a bottle and carry it across the room in that hand without dropping it. Her gait has improved. Her energy has improved. And as you can imagine, the encouragement now that this woman has that she possibly can have an improved quality of life is phenomenal. And every time
all this without any surgical procedure and no medication.
Absolutely,
right?
Absolutely correct. Okay. Just Neuro20 and the nutrition and the protocol. Putting her through the appropriate protocol.
And you're measuring this because you got the WAVi Brain Scan that you can go back and say, we know this is improving.
Absolutely correct. Absolutely correct. And also, we're recording her. So, and her husband is observing this and he's her primary caretaker. He's been observing this for 20 years. And so she's changed. Typically, as people age with these kind of problems, they just continue to decline.
Right.
She's now reversed that, and she's better off than she was 10 years ago as far as her ability to do things. Another woman we have, she came in to see me, and she has significant movement of the spine. It's called spinal lithosis. One vertebrae is slipped over on the other. She has a significant bulging disc, and so she had foot drop. The disc,
my brother had that. I know exactly what it is.
Disc is pushing on the nerve. She has foot drop, so she really has to be careful about walking. After the third treatment, 75% of the foot drop is gone. She's now had 6 or 7 treatments. It's completely gone. And she has no back pain. She has no back pain. She is just amazed that she's now back to normal life. She's back to exercising. She's back to hiking, doing all the kinds of things that she was doing before any of this happened.
Do you see why I do these kind of radio shows? Do you understand why I'm doing this? I'm trying to bring you information you're not going to find on your own, typically, okay? And an opportunity for you to learn how, regardless of what the situation is, if it involves these kinds of injuries, these kinds of things that you or a loved one may be dealing with, whether it's stroke, whether it's Parkinson's, there's a whole list, okay, that we can go through with Dr. Andersen, regardless of what it is. If you want to find out if you can get some help without having to go through a surgical procedure or take another damn pill, maybe you ought to take a look at what they can do. The website is PainLabKC.com, PainLabKC.com. The phone number 833-724-6522, 833-724-6522. Open house, first Thursday of every month from 3 to 6. We'll be right back after the break. Doctors are still in the house. Stay tuned. We've got more here on America's Healthcare Advocate, broadcasting coast to coast across the USA here on the HIE Radio Network. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIE Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. That was pretty powerful, wasn't it? I mean, seriously, when you heard all of that? Once again, the website is PainLabKC.com, PainLabKC.com. You want to call a good appointment, just go over there, meet with Steve, meet with the doctor, see what they can do, tell them what your situation is, and maybe they can help you. In fact, I'd be willing to bet they probably can help you. And you want to do that by calling 833-724-6522, 833-724-6522. Dr. John, you were a professional soccer player. You were a college All-American. I know that you're working with Steve and with Dr. Andersen to put a protocol in place to help soccer players here in the Kansas City Metro. And by the way, we have one of the largest soccer organizations, multiple soccer organizations in the country, right here in the good old heartland. So talk a little bit about, I recall when we first started doing WAVi 4 years ago, Steve and I, and Dr. Palermo was talking to us about this product. And I was like, well, the worst concussion protocol, the worst athletes are going to have concussions are football players. And he goes, wrong. It's girls soccer, Carrie. So take it, doctor.
It is girls soccer. But I'd like to start with my very own self. This is something that happened when I was a senior in high school, 1969. I had a collision. I was trying to head the ball to score a goal, and my head was headed by another player. And I went down, and this is before they knew much about concussion. Went down, got up. Referee said, John, get up. I got up. Played, and next thing you know, I don't remember the rest of the game. It was the first half, and the second half we had a penalty, and I wanted to take it, and I looked at the ball. The ball looked like it was a mile away. I was looking into the Atlantic Ocean, the stadium we were playing at King George V Stadium. But anyway, I'm bringing this up because I wouldn't be here today. I was fortunate because after that game, I ended up in the hospital. I was comatose for 2 days, and I stayed in the hospital for 10 days. This was a semifinal, and next thing you know, I ended up playing in the final. Yeah, we won. I scored 2 goals, but this was high school. But the problem that I have now, and that's why I'm so very much involved with the WAVi, since Steve brought it to my attention, because it's extremely valuable. I could have been dead. I would not, like I said, all what happened after that, for me, I've looked at life as gravy. So it's critical that when you have a concussion, that we go ahead and make sure that they're tested and make sure they're ready to get back. And that's what the WAVi is for.
So, Dr. Andersen, and to the parents that are listening that do have student athletes, the best way for them to find out, number one, is not wait until they have a concussion. If you get a baseline scan done, talk a little bit about that and why that makes a lot of sense. If you've got a kid in any sport where there's physical contact, just chat about that a bit.
Absolutely. The WAVi is about a 40-minute test that gives us a baseline of what their P300 is doing. And it tells us then when we subsequently have them checked, say at the end of the season, what's transpired in between times. And they think, oh, I didn't have any head injuries. And all of a sudden it shows up and the subsequent one, you did have a head injury. We need to address that. And as well, then more serial tests, we basically track and treat. So we look at what is it and we treat it. We recheck it again to see how much improvement have we had. And we proceed from there. Each person is an individual. We look at their nutrition. We look at their supplementation. We look at what activities they're doing, get those tests in there, and see how they respond.
Yeah, and I'm going to give you a quick example. We have another doctor that we've worked with here, is Dr. Schultz, who had a hockey player out of high school, was getting ready to go to the pros, okay? And he'd had 4 concussions. And Dr. Schultz had heard about WAVi, knew a little bit about it, reached out to us. The test was done. When the test came back, when the results from the WAVi were presented to him, that boy was no more able to go back and play. If he'd have gone back, he could have put himself in danger for the rest of his life and certainly would have impacted his ability to function. The point is, 6 months later, he had recovered. We were able to, again, do a scan on him that showed he'd improved, and they were able to get him back in track so he was able to go play hockey. So the point is, if you have a baseline, then when something happens, it's not normal now because what was green is now red as it shows up on the scan. You've got a problem, right, doctor?
Correct. And it's an objective test as opposed to a subjective test, because I can tell you, as having been an athlete, and I know Dr. John, the same thing. Oh, yes, I'm good to go back in, coach. Yes, I'm fine. And that's not an objective test. And we have to have objective testing to show that we are actually helping the brain getting back to normal and know when it is normal. So now it's safe for these children to go back.
And the other thing is, with the Neuro20 suit, you can actually go back, run the scan again, and see what a difference has been made from using the Neuro20 versus when they started, correct?
Absolutely correct. And because that's our primary treatment modality, along with the nutritional things, is to get that in there. We also may do some photobioluminescent treatment in there to help. Anything to put that whole package together to regenerate the brain. That's what we're doing. And in reality, this has really rekindled my excitement in practicing medicine again. And it's something that we can do to help people non-invasively with a major problem in our young people and as well as our elderly.
For those of us that are chronologically challenged and have a lot of these kinds of issues.
That's correct. And really nothing else is being done to resolve these problems. There's a lot of treatments, but they're not resolving. They're only palliative for the most part. And I see that particularly in our veterans. They're just giving them suppressants. They're giving them various different antidepressants. That's correct. But that's the standard modality because they don't know what else to do.
And it does make a difference. I want to thank you both. I know you're really busy. You've got practices and everything that you're dealing with patients every day, for taking the time to come in here. And I want to invite you now to come back and we'll do some follow-up shows on this, because I think this message is critically important for all of you out there to be able to hear this. We do these kinds of shows for a reason. As I always say, I'm here to educate and inform, and that's what I'm trying to do. I don't care where you're listening to the show, anywhere in the country. If you want to reach out to Steve Sanborn, okay, at PainLab KC, you can certainly do that, okay? And I'm sure they'll be happy to talk with you. Maybe there's a practice somewhere else in the country they can refer you to, or you certainly can come to Kansas City. We got a brand new airport. Love to have you show up. If you want help with something. But the whole idea behind this is to tell you, if you think there's no hope because you've had a stroke, you've got Parkinson's, you've had an injury, your child is injured, whatever the case may be, you're wrong. Because there is a way to do this without surgery, without meds. PainLabKC.com is the website. The phone number, 833-724-6522. If you've got an issue, I urge you to take the time to go connect with these folks and see what they can do for you. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words are never spoken. Thank you for listening to America's Healthcare Advocate today, broadcasting coast to coast across the USA. Goodbye, America.